I have never showered in scrubs and I've never revised in the shower, I promise. I'm a final year medical student and today we're reacting to medical memes. Let's go.
All right, full name.
Clifford Burnett.
Date of
Very good.
birth.
November 16th, 1968.
Age.
Can't you figure that out based on my date of birth?
I'm a doctor, Cliff, not a mathematician.
33.
Okay, that's really valid. Sometimes, people will go, oh, shouldn't you be able to work that out? Yeah, I should, but it's a little bit quicker if you just tell me.
Brothers and sisters of the light, it's time to get activated. The Lionsgate portal is officially open.
Okay, I'm not going to call out my psychiatrist supervisor like that. They are incredibly knowledgeable both on the psychology side of things, but also, have you seen psychiatric medication? The amount of physiology you need to know to give the correct drugs, elite ball medical knowledge.
So macrocytosis or macrocytic. So they'll have very, very large red blood cells. And these red blood cells, will they be able to deliver as much oxygen?
Okay, the ninja nerd is completely valid. The amount of times that guy has saved me in exams, brilliant. But I've never had to duct tape myself to a chair so far. This is so true. There's so many little niche names for little bumps, dips, and grooves. Pedicles, tubercles, notches, trochanters. Yeah.
Tanzen. Das war ein Befehl! Der Angriff steigert war.
This is why you need to put the phones down when it starts getting dark, or at least the screens and the light. Essentially, as it starts to get darker, your brain starts to release a hormone called melatonin, and as soon as you start getting that light back into your eyes, this production stops, as the video very well demonstrates, and you struggle to get to sleep.
My exam's in 2 hours, bro. I'm so cooked here.
Okay, I have never showered in scrubs, and I've never revised in the shower, I promise. This is from a really good show called Scrubs. The guy is JD. Highly recommend it, by the way. I remember doing my first venipuncture, taking blood for the first time. My hand looked a bit like that, to be fair. Got it on the second attempt, though. Okay, this is very true. Particularly what I first encountered it on my placement was with heart failure patients. Essentially, when you have heart failure, your heart is pushing too much fluid out of the body. And what we'll do is we'll give certain medications that get rid of that fluid. Unfortunately, a lot of these medications will be bad for your kidneys. So there's constantly just fighting back and forth between meds for the kidneys, meds for the heart, not giving the meds for the hearts because of the kidney, but then the heart gets worse, which you need, and it's this big clash, which leads to a joke about cardiologists and nephrologists, who are heart doctors and kidney doctors, arguing.
I might slide with the Glock, there's some relevance. Took his rocks, took his sediments.
So there's a lot of weird and wonderful words that we use to describe symptoms, and some of the ones mentioned in here are those. Sometimes, I'll admit, I have to look up what they are when they're said, especially if it's written down. There is just so many. I think it's something like you learn 10,000 words throughout your entire medical school. So, same as with the dictionary. Sometimes you've got to double check things. What's even more confusing is sometimes the same acronym means something completely different depending on the specialty. So it can get really confusing. Doctors aren't searching it up because they don't know. They're just checking the latest guidelines. Things change so much, so quickly. There's always new research being done. And what might have been a good medication 5-10 years ago when someone qualified might not be the best option now. Just saying, just saying. I'm not sure if that's the case about boosting their ego, but there are some really obscure niche questions that I've been asked in theatre before. For example, some surgeon once just went, tell me about the clotting cascade. But I was just there like, von Willebrands? If you are going to medical school, be prepared to be put on the spot a lot. A pass is a pass, okay? I stand by my words. A pass is a pass. In medical school, whether you pass with a lower percentile or a higher percentile, you've reached the minimum standard to be a safe and effective healthcare professional / doctor / nurse. It's okay.
Shimmy, shimmy, cocoa pop. Shimmy, shimmy, pop.
Okay, this is pretty valid. The mnemonics that we use, some of them aren't they're the best, but they help us remember it and they make us better students. So I'm going to count that as a win.
Every sentence, every paragraph, spoons, bread, salad, pepper. Don't you understand? My brain is full to bursting. If I have to memorize a single order, I think I'm getting
Okay. I've had moments like that. I have had keyboard head bashing moments when I've actually been like, I cannot do this. Sometimes you've just got to take a breath, leave the work behind, and go for a walk. That's the end of the video. I hope you enjoyed. This is my first YouTube video, so hey, if you do enjoy, please like, follow, and subscribe. And I'm going to be doing more. See you later. Stay healthy. Medlifts out.